This section covers disorders of the thyroid gland. The thyroid gland is a butterfly-shaped gland located in the front of the neck. Before we look at the disorders, let's first look at how thyroid hormones are regulated. The hypothalamus secretes thyrotropin-releasing hormone or TRH. This stimulates the anterior pituitary gland to release more thyroid-stimulating hormone or TSH into the circulatory system. TSH stimulates the thyroid gland to produce thyroid hormones. There are two thyroid hormones, triiodothyronine or T3 and thyroxine or T4. 80% of thyroid hormone is secreted in the form of T4, but T3 is the active form. Sufficient blood levels of thyroid hormones will then exert a negative feedback to inhibit the secretion of TSH and TRH. When excessive thyroid hormones are produced, this is known as hyperthyroidism. The most common cause of hyperthyroidism is Graves' disease. Graves' disease is an autoimmune disorder where the immune system releases abnormal antibodies. These abnormal antibodies mimic TSH and stimulate the thyroid gland to produce excessive thyroid hormone. Other possible causes of hyperthyroidism are overactive thyroid nodules, which are clusters of tissues that overproduce thyroid hormones, thyroiditis, which is inflammation of the thyroid gland, and consuming too much iodine, because iodine is a building block of thyroid hormones. Thyroid hormones regulate metabolism, so most signs and symptoms of hyperthyroidism can be linked to increased metabolism. For example, fast heartbeat or tachycardia, irregular heartbeat or arrhythmias, excessive sweating, hand tremors. The person feels nervous, excitable, or agitated. Although the person is tired, she has difficulty sleeping. Although the person is eating more, she is losing weight. Even the GI tract is overly excited, resulting in diarrhea. The thyroid gland may be enlarged, causing goiter, which is a swelling in the neck. And in Graves' disease, patients may also have exophthalmos, which means protruding eyes. Hyperthyroidism can be treated with antithyroid drugs, for example, carbimazole and propylthiouracil. Another treatment option is radioactive iodine therapy. In radioactive iodine therapy, radioactive iodine is ingested. The radioactive iodine collects in the thyroid gland and destroys part or all of the thyroid gland. A third treatment option is surgery to remove part or all of the thyroid gland. On the flip side, hypothyroidism occurs when the thyroid gland does not produce sufficient thyroid hormones. The most common cause is an autoimmune disease known as Hashimoto's thyroiditis. Ironically, the second most common cause is actually the result of medical treatments. After someone gets radioactive iodine therapy or thyroid surgery, they may have no or too little thyroid gland tissue left, and this results in hypothyroidism. Hypothyroidism can occur at any age, but it is more common among the elderly and in women. The signs and symptoms of hypothyroidism reflect a decrease in metabolism. For example, cold intolerance, which means the person feels cold easily, weight gain, slow heart rate, forgetfulness, fatigue, muscle weakness. The GI tract slows down as well, resulting in constipation. There is also a change in physical appearance, for example, dry skin, hair loss, bloated appearance, thick tongue, and puffy eyelids. Hypothyroidism is treated by administering synthetic thyroid hormone. Now let's take a look at goiter. Goiter is the enlargement of the thyroid gland. As you can see in this photo, there is a swelling at the front of the neck. Goiter is not a disease, rather it is a sign of an underlying medical condition. There are several causes of goiter. Hyperthyroidism, hypothyroidism, and thyroid cancer can all cause goiter. However, the most common cause for goiter worldwide is actually iodine deficiency. Iodine is a building block for thyroid hormones, so a person with iodine deficiency will not be able to produce the thyroid hormones T3 and T4. When T3 and T4 levels are low, the pituitary gland secretes more thyroid-stimulating hormone to stimulate the thyroid gland. The thyroid gland enlarges, resulting in goiter. The treatment of goiter depends on what is causing it. If the goiter is caused by iodine deficiency, then obviously the treatment is to add iodine to the person's diet. Iodine is usually found in seafood, dairy, and eggs. Iodized salt is also available, where small amounts of iodide have been added to the salt. In this section, we have covered hyperthyroidism, hypothyroidism, and goiter. Before moving on to the next section, try to recall what these conditions are and what causes them.